This session focuses on mastering the critical skill of EMS patient handoffs. We will explore why delivering an accurate and thorough report is paramount for patient safety and continuity of care, preventing errors and misunderstandings. You'll learn the essential components that constitute an effective handoff, including patient presentation, assessment findings, interventions performed, and response to treatment. We will also examine common communication pitfalls, such as incomplete information or environmental distractions, that can jeopardize the process. Finally, we'll practice utilizing structured communication tools like MIST, mechanism, injury/illness, signs, treatment, and to ensure clarity, conciseness, and completeness during the transfer of patient care responsibilities. Effective handoff reports are critically important in healthcare for several interconnected reasons. Primarily, they ensure the seamless continuity of care, as the safe transition of a patient relies heavily on the accurate and timely transfer of vital information between providers. This precise communication is crucial for preventing medical errors and avoiding the unnecessary and inefficient duplication of tests or treatments. Furthermore, well-structured and concise handoffs save valuable time, particularly during critical interventions where rapid understanding and action are paramount. Lastly, the consistent practice of delivering thorough and reliable reports actively builds trust and fosters stronger collaboration between different healthcare providers and teams, ultimately contributing to safer and more efficient patient management. A comprehensive and effective handoff report systematically includes several key components to paint a clear picture for the receiving provider. It should begin with the reason for the encounter, detailing the patient's chief complaint or the specific mechanism of injury, MOI, or nature of illness, NOI. Essential patient identifiers, such as age, gender, and name, when known and permissible, must be relayed for accurate identification. Critical objective information includes the latest set of vital signs, highlighting any significant trends observed during transport or care. A concise summary of all interventions performed is crucial, specifying what was done, e.g., for fluids, medication administration, when it occurred, and importantly, how the patient responded to the treatment. Furthermore, conveying information about the patient's current medications and any known allergies is vital for safety and ongoing care. Finally, including any relevant medical history that could impact the current condition or treatment plan provides essential context for the receiving team. The MIST handoff model represents a vital structured communication protocol, specifically engineered to optimize the transfer of critical patient information in high-pressure, time-sensitive environments such as pre-hospital emergency medical services, EMS, and trauma care settings. Its primary purpose is to ensure clarity, brevity, and completeness, thereby minimizing the risk of errors or omissions that can occur during rapid verbal exchanges between care teams. This structured approach is particularly valuable when transitioning a patient from the field to the emergency department or during interfacility transfers involving critically ill or injured individuals. MIST is an acronym that systematically organizes the essential data points. M. Mechanism of injury or mode of illness. This component requires the reporting provider to clearly articulate the circumstances surrounding the patient's condition. For trauma, this includes details like the type of incident, e.g., motor vehicle collision specifying impact type and speed, fall detailing height and surface, penetrating versus blunt trauma, which helps predict potential injury patterns. For medical patients, it describes the nature of the illness onset, e.g., sudden versus gradual, associated activities, environmental factors. Providing this context is crucial for the receiving team to anticipate potential underlying issues. I. Injuries or illness sustained. Here, the provider summarizes the specific physical injuries identified or the primary aspects of the illness diagnosed or suspected based on the pre-hospital assessment. This involves relaying findings from head-to-toe examinations, such as suspected fractures, neurological deficits, e.g., paralysis, altered mental status, major bleeding sites, burns, or the key features of the medical presentation, e.g., chest pain characteristics, respiratory distress signs, stroke symptoms. S. Signs. This element focuses on objective findings and key subjective reports. It includes the patient's vital signs, not just the most recent set, but also significant trends observed over time, e.g., improving or deteriorating blood pressure, rising or falling heart rate, changes in oxygen saturation or respiratory rate. It also incorporates other crucial signs like the Glasgow Coma Scale, GCS, score, pupil reactivity, skin condition, color, temperature, moisture, significant electrocardiogram, ECG, findings, and pertinent symptoms reported by the patient, such as pain severity and location, presence of nausea, or difficulty breathing. T. Treatment given. This final section outlines all interventions performed by the reporting team. It should specify actions such as airway management techniques used, oxygen administration details, hemorrhage control measures applied, e.g., tourniquets, pressure dressings, intravenous, 4, access obtained, location and size, fluids administered, type and volume, medications given, name, dose, route, and time, splinting or immobilization performed, and any other significant care provided. Crucially, this section must also include the patient's response to these treatments, noting any improvements, deteriorations, or lack of change in their condition or symptoms. By adhering to the MIST framework, healthcare providers can deliver a focused, organized, and comprehensive snapshot of the patient's situation and the care rendered thus far. This structured communication facilitates quicker comprehension by the receiving team, allowing them to more effectively prepare resources, anticipate needs, and ensure a seamless and safe continuation of patient care, ultimately contributing to better outcomes in emergency and trauma scenarios. Now let's go over an example MIST report. For mechanism, we have a 24-year-old male who was involved in a motor vehicle collision as the front seat driver. He was reportedly not wearing a helmet. For the injuries identified include an obvious deformity noted to the left femur, as well as some minor lacerations. For the signs, the patient is alert and oriented. His current vitals are a heart rate of 120, blood pressure is 100/60, and his respiratory rate is 24 breaths per minute. The treatment provided includes the application of a cervical collar, and the affected leg has been splinted. Achieving a truly effective and safe patient handoff requires conscious effort and adherence to several key communication principles, moving beyond a simple data dump to a focused transfer of responsibility. Firstly, mastering the balance between being concise and thorough is paramount. This involves filtering information to present the most critical data points relevant to the patient's current state and anticipated needs, while still providing enough detail, such as pertinent medical history, assessment findings, and interventions, to create a comprehensive clinical picture without overwhelming the receiver with extraneous details. Secondly, clear communication necessitates actively avoiding ambiguous language, discipline-specific jargon, or acronyms that might not be universally understood by everyone involved in the patient's care continuum, e.g., specific EMS protocol numbers might be meaningless to hospital staff. Equally important is avoiding assumptions about what the receiving provider may already know or infer. Spell out crucial details explicitly to prevent potentially dangerous gaps in understanding. Furthermore, it is vital to highlight any significant changes in the patient's condition observed during your period of care. This includes reporting deteriorations, e.g., worsening vital signs, decreased level of consciousness, as well as improvements, e.g., positive response to treatment like pain relief after medication, as this information provides critical insight into the patient's trajectory and the effectiveness of interventions. To ensure the information has been accurately received and understood, especially in often noisy and chaotic environments, actively confirm understanding. This goes beyond simply asking any questions. Employ closed-loop communication techniques, such as requesting a repeat back or read back of critical information like vital signs, medication dosages, or the primary assessment findings, or asking targeted questions to gauge comprehension. Finally, whenever feasible and appropriate, Provide supporting documentation alongside the verbal report. Handing over a copy of the written patient care report, PCR, ECG strips, medication lists, or other relevant records offers a tangible reference for the receiving team, reinforces the verbal exchange, and ensures detailed information is available for review. Consistently applying these tips helps to minimize misunderstandings, reduce medical errors, foster better teamwork, and ultimately ensures a safer, smoother transition of care for the patient. Effectively transitioning patient care relies heavily on avoiding several common, yet potentially dangerous, pitfalls that can plague the handoff process, significantly increasing the risk of medical errors and negatively impacting patient outcomes. Perhaps one of the most frequent and perilous failures is the transmission of incomplete information. This goes beyond minor omissions. It involves critical failures like neglecting to mention known severe allergies, leading to anaphylaxis risk, forgetting to relay all interventions performed, like specific medication dosages or the volume of 4 fluids administered, resulting in potential overdoses or inadequate resuscitation, or failing to communicate crucial baseline information, such as a patient's normal mental status versus a new confusion, leaving the receiving team without vital context for assessment and decision-making. The consequences of such gaps can range from delayed diagnosis and treatment to serious adverse events. Equally problematic is poor timing of the handoff. Attempting to convey complex patient information during critical moments, such as active resuscitation, managing a rapidly deteriorating patient, or amidst the controlled chaos of an emergency department arrival, is fraught with peril. In these high-stress moments, both the sender's ability to articulate clearly and the receiver's capacity to listen attentively and retain information are severely compromised due to cognitive overload and numerous environmental distractions like alarms and competing tasks. This significantly elevates the chance of critical data being missed, misheard, or forgotten entirely, potentially delaying life-saving actions. Furthermore, striking the appropriate balance of detail is a persistent challenge. Providing too much extraneous or disorganized detail, often referred to as a data dump, can overwhelm the receiver, making it difficult to quickly identify the most critical pieces of information buried within the narrative. Conversely, providing too little detail, such as vague descriptions like difficulty breathing, without specifying respiratory rate, work of breathing, oxygen saturation, or interventions attempted, forces the receiving clinician to make assumptions or spend valuable time seeking clarification, potentially delaying appropriate care. The goal is tailored relevance, providing enough data for safe continuation of care without unnecessary clutter. Compounding these issues is the frequent lack of a standard format for delivering the report. Without a mutually understood structure, like SBAR or MIST, handoffs often become disorganized streams of consciousness, jumping between history, assessment, and treatment illogically. This makes it exceedingly difficult for the receiver to follow, process, and retain the information systematically, increasing the likelihood that key elements are inadvertently omitted by the sender or missed by the receiver. A standardized approach acts as a cognitive aid and safety checklist, ensuring all essential domains are covered consistently. Recognizing and actively mitigating these common pitfalls through structured communication, careful timing, appropriate detail, and a commitment to completeness is fundamental to ensuring patient safety across transitions of care. While the MIST framework provides a solid structure for patient handoffs, its application requires special considerations when dealing with certain patient populations or challenging circumstances to ensure all critical information is effectively conveyed. For instance, with pediatric or elderly patients, obtaining an accurate history for the M mechanism/mode and I injury/illness components might depend heavily on input from caregivers, and subtle changes noted in S signs can be highly significant. Furthermore, the T treatment section must often include details about weight-based calculations or adjustments made due to age-related physiology or comorbidities. In cases of nonverbal or unconscious patients, the S signs component becomes almost entirely reliant on objective findings like vital signs, neurological assessments, e.g., GCS, and physical exam results, as subjective symptoms cannot be reported, making scene findings crucial for understanding M and I. When encountering language barriers, it's essential to note the barrier itself within the report and describe any methods used to communicate: interpreters, translation apps, family members, acknowledging potential limitations in the accuracy of subjective information gathered for I and S. Lastly, for combative or intoxicated patients, the handoff needs to include pertinent behavioral observations under S, detail any safety precautions or restraints used under T, and clearly differentiate, if possible, between behavior potentially related to intoxication and signs suggesting underlying medical issues or injuries, I. Addressing these specific nuances within the MIST report ensures a more comprehensive and contextually appropriate transfer of care. To thoroughly summarize the essentials of effective patient handoffs, it's crucial to understand their profound impact. Delivering accurate, structured reports during care transitions is not merely procedural, but a cornerstone practice that directly improves patient outcomes. This improvement stems from reducing preventable medical errors, ensuring vital information flows seamlessly for continuity of care, and facilitating timely, appropriate interventions, all of which significantly bolster patient safety. To achieve this level of reliability, healthcare teams are strongly encouraged to use standardized formats like MIST, mechanism/mode, injury/illness, signs, treatment, or SBAR, situation, background, assessment, recommendation. These frameworks provide much-needed structure, fostering clarity by creating a predictable sequence for information, establishing a shared mental model among providers, and serving as a cognitive checklist to ensure all critical domains are consistently covered. Beyond the structure provided by these formats, the manner of communication is equally vital. Every handoff interaction must strive to be clear, utilizing unambiguous language and avoiding potentially confusing jargon. Concise, focusing sharply on the most clinically relevant data without unnecessary rambling that can obscure key points. And focused, prioritizing information according to the patient's acuity and the immediate needs of the receiving team. This disciplined approach prevents information overload and ensures critical details are easily identified. Finally, and perhaps most critically, effective communication requires closing the loop. Providers must always confirm understanding with the recipient. This involves actively verifying that the information transmitted was received accurately and understood as intended, often employing techniques like asking the receiver to summarize key points or using formal repeat-back protocols for critical data like dosages or vital signs, thereby minimizing the risk of errors born from assumptions or misinterpretations. Embracing these principles transforms the handoff from a potential vulnerability into a robust component of safe, efficient, and collaborative patient care. Thank you for completing this lesson. We hope you found the course informative and valuable. Please proceed to the post-test to assess your knowledge of the topic. And that you for visiting easyems.com.